Now let's turn to politics, because President Obama and his family have headed west as his administration appears to be backing off of a controversial piece of his health care plan. NBC's chief White House correspondent Chuck Todd is traveling with the president. He's in Phoenix this morning. Hey, Chuck, good morning.
Good morning, Ann. Well, the president came out west for a working vacation to do two types of sightseeing. Number one was to see a lot of these natural wonders of the West, from the Grand Canyon to Old Faithful, but he also got a first-hand look at some of the skepticism he's facing in his pitch to overhaul health care. The Obama family has been taking in the beauty of the American West, from Old Faithful and Yellowstone National Park to the spectacular views from the Grand Canyon. The First Lady and daughters Sasha and Malia even went whitewater rafting. But it's the rough waters of the healthcare debate that have occupied Mr. Obama on this trip. Unlike the mostly friendly crowd he faced in New Hampshire, in town hall meetings in Montana and Colorado, the president faced tougher questions from skeptics of his plan.
Why is it that you've changed your strategy?
You can't tell us how you're going to pay for this.
In a New York Times op-ed on Sunday, the president continued to make his case for health care reform, that it will control costs, make Medicare more efficient, and give those without health insurance a choice. The same message he has delivered on this road trip.
And we will do all of this without adding to our deficit over the next decade, largely by cutting waste and ending sweetheart deals for insurance companies that don't make anybody any healthier.
But Mr. Obama appears to be stepping back from the idea of a government-run public option.
The public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it.
On Sunday, Health and Human Services Secretary Kathleen Sebelius downplayed the idea further.
And I think what's important is choice and competition, and I'm convinced at the end of the day the plan will have both of those, but that is not the essential element.
The alternative to the public option favored by some in the Senate is a co-op, a government-influenced but not run insurance plan authored by North Dakota Democrat Kent Conrad.
The fact of the matter is there are not the votes in the United States Senate for the public option. There never have been. So to continue to chase that rabbit, I think, is just a wasted effort.
Now, late yesterday, the Deputy White House Chief of Staff Jim Messina tried to reassure some progressive/liberals activists who are upset to hear about this public option. The email read in part, "Nothing has changed. The president has always said what is essential is that health reform must lower costs and ensure that there are affordable options for all Americans." Still a lot of wiggle room there, Matt.
Chuck Todd, thank you very much.